Hello, today I will be conducting flexion and extension of the proximal and distal IP joints. The common muscles for IP flexion are the flexor digitorum superficialis and profundus. The common origin is the common epicondyle of the humerus, and its insertion is either the medial or distal phalanges. The muscles for IP extension are the lumbricals, which originate in the tendon of flexor digitorum profundus in the palm and insert in the corresponding extensor digitorum on the fingers. For time purposes, the assessment will be demonstrated in only one finger, but in practice, all fingers need to be assessed. Hi, my name is Ines Lomelli. I'm an occupational therapy student at Nova Southeastern University. What's your name?
Emily.
Emily, how would you like to be addressed?
Emily.
Okay, Emily, well, what I will be doing today, I will be doing manual muscle tests and range of motion, basically just seeing how if you're able to bend and extend your fingers and how strong the muscles are that allow you to do that movement. Anytime during this procedure, if you feel any pain, discomfort, let me know and I will stop. Okay? Is it okay if I touch you and move you around a little bit?
Of course.
Okay. Also, just to let you know, before I came in, I sanitized the area and I have already washed my hands.
Perfect.
Okay. First, what I want you to do, are you able to bend your fingers and extend them? Do you feel any pain?
No.
No? Okay. So the first thing I'm going to do is measure your flexion with the goniometer, and I'm going to put it on 0. So what I want you to do is bend your finger when I indicate it, okay? So the axis is at I'm going to measure the proximal phalange, and the axis is on the proximal interphalangeal joint. The stationary arm is going to be on the longitudinal axis of the proximal phalange, and the movable arm is going to be on the longitudinal axis of the middle phalange. Okay, can you bend your finger for me? I'm going to follow that. Okay, your flexion is 103 degrees. Okay, now I'm going to measure the flexion of your distal interphalange, and the axis is the distal interphalangeal joint. The stationary arm is the longitudinal axis of the middle phalanx, and the movable arm is on the longitudinal axis of the distal phalanx, and I'm going to stabilize right here. Okay, can you flex your finger for me? Okay, could we do that again? Okay, could you flex for me? Okay, and the reading for that was 37 degrees. Okay, now I'm going to measure extension, and this is going to be on the palmar side. And extension of your proximal interphalange is the axis is the proximal interphalangeal joint. The stationary arm is on the palmar side of the longitudinal axis of the proximal phalanx. The movable arm is on the longitudinal longitudinal axis of the middle phalanx. Okay, could you extend your finger for me? Okay, and the reading for that was 20 degrees. Now I'm going to measure the distal interphalange, and the axis is a distal interphalangeal joint. The stationary arm is along the longitudinal axis of the middle phalanx. The movable arm is on the longitudinal axis of the distal phalanx. Can you extend your finger for me? Okay, good job. That was 26 degrees. Okay, now I'm going to conduct manual muscle tests. So I'm going to see how measure for extension. I'm going to stabilize the proximal interphalangeal joint and apply resistance at the middle phalange. Don't let me break it. 1, 2, 3. Okay, good job. Now I'm going to measure the distal interphalange, stabilize the middle phalange and apply resistance at the distal. 1, 2, 3. Good job. Okay, now for flexion, I'm going to stabilize the proximal phalange and apply resistance at the distal. See, don't let me break it. 1, 2, 3. And same thing for the to measure the distal phalange. I'm going to stabilize the middle phalanx and apply resistance at the distal. Okay, 1, 2, 3. Good job. Well, what that tells me is you're at a level 5. You're able to resist my flexion and extension, so you have good muscle strength, and your range of motion is within normal limits. Okay, do you have any questions?
No.
Okay, well, thank you for coming in and seeing me. And after the patient has left, I sanitize the area and wash my hands.